A woman in her 50s closes the bathroom door quietly, sighing in frustration. Hi, I'm Dr. Behnaz, certified pelvic floor specialist. Let me ask you something personal. Have you recently found yourself leaking urine when you laugh or rushing to the bathroom with a sudden overwhelming urge and wondering why is this happening now? If you're in your 40s, 50s or beyond, and especially if you've entered menopause, you're not imagining this. These changes are real and they're hormone related, but here is the good news, they're also treatable. Today, I want to explain in clear, compassionate terms what's really going on with your bladder after menopause. And I'll show you how we, as pelvic floor specialists, approach this stage of life with science, care, and real solutions. Let's talk about your body and how we can support it. First, let's understand what menopause means for your tissues. Estrogen is more than a reproductive hormone, it's a tissue builder. It keeps the walls of your vagina, urethra, and bladder plump, elastic, and supported. Once menopause arrives and estrogen levels drop, things start to shift. Your urethra things out, making it harder to stay closed. The bladder lining becomes more sensitive and irritable. Pelvic floor muscles may weaken. You might notice more urgency in nighttime bathroom trips or even recurrent infections. You might be wondering, why am I leaking now when I didn't during childbirth? Or why does even a tiny sneeze cause a drip? The answer lies in the loss of hormonal protection. And the good news is we can work with that, not against it. In my practice, I hear the same things again and again from postmenopausal women. I used to laugh freely, but now I brace for leaks. I don't drink water when I'm out. I'm scared. I don't make it to a bathroom. I feel dry down there and intimacy is uncomfortable. I used to be so in control of my body and now I feel like I'm falling apart. These stories are so common, but they're not the end of your story. They're just the start of a new chapter, and with the right support, that chapter can be strong, confident, and leak free. When someone walks into my clinic during or after menopause with urinary incontinence, here's what we do. We look at tissue health. We assess the tone and thickness of the vaginal and urethral tissues, the ability of the pelvic floor to contract and relax, the response of the bladder to common triggers like cold water, sounds, or movement. Often, I find that the pelvic floor isn't just weak, it's under-responsive, meaning it's slow to react when pressure or urgency arises. If tissues are thin, dry, or prone to irritation, I might encourage you to talk with your gynecologist about local estrogen therapy. This isn't systemic hormone therapy. It's a gentle, targeted cream or insert that stays local, right where your body needs it. It helps rebuild the lining of the urethra and vaginal canal, improve muscle sensitivity and response, reduce recurrent UTIs and painful dryness. When paired with physical therapy, the result can be truly life-changing. So about exercise therapy, every exercise we do is personalized and gentle. We start with breathing-based core and pelvic floor awareness, visualization techniques like gently lifting a blueberry, gradual endurance training for pelvic support, and teaching reflexive control like using the neck technique before you sneeze. This isn't a workout. This is re-education for your deepest muscles. Imagine your bladder and brain learning to trust each other again instead of rushing you to the bathroom. You start with a gentle routine of timed bathroom visits, slowly nudging the gap between the trips so your bladder can stretch and hold more. When an unexpected urge arises, you pause, breathe, and use gentle pelvic floor squeezes or calming distractions until the urge settles like a wave that naturally fades. As your body learns this rhythm, urgency becomes less urgent and you move toward the toilet with ease and confidence. Over time, fewer bathroom trips and fewer leaks will let you live more freely, responding to your body with calm, not worry. So let me tell you about a patient I recently saw. She was 59, healthy, active, but terrified of traveling or going to the gym because of leaks. She wasn't drinking enough water. She avoided intimacy and she felt embarrassed even though she had nothing to be ashamed of. We worked together. She started local estrogen therapy. We practiced pelvic floor release, breathing, and timed strengthening. We cleared out bladder irritants and she learned to delay urgency step by step. 3 months later, she was on a road trip with her sister and not a single accident. She wasn't laughing again. She felt like herself. And now, key takeaways for you. Menopause does not have to equal incontinence. Hormones affect your tissues, muscles, and bladder signals, but we can work with these changes. Local estrogen, pelvic floor therapy, and smart lifestyle adjustments can transform your experience. You're not alone and you're not past your prime. You're just ready for a new approach. In our next video, we'll talk about pelvic organ prolapse and incontinence, what it is, how it's related to urine leaks, and what non-surgical options you have to feel supported again. I'm Dr. Behnaz, certified pelvic floor specialist, and I'm here to walk this with you. Thanks for watching. If this video helped, please subscribe, like, and turn on the bell so you won't miss more helpful tips for your pelvic health.